Welcome to YARKUD International. Today we are going to see the important medical question from the Saudi Prometric exam. First question, the nurse is preparing teaching plan for the several patients. The nurse should recognize which of the following patient is at greatest risk for fluid and electrolyte imbalance. So you have to find out which patient is the greater risk for the fluid and electrolyte imbalance. Let's see. The 2 years old patient who is receiving gastrotomy feeding, a 20 years old patient, the sigmoid colostomy, 40 years old patient who is 3 days post-operative with the ileostomy, and 60 years old patient who is 8 hours post-renal angiography. Okay. So these are the options. So now we have to be look for the important thing. Okay, that is a pediatric and geriatric also given 2 years old, 60 years old also given. They are the risk for the fluid and electrolyte imbalance. But here they are asking greater risk. Okay, so all of them is risk for fluid and electrolyte imbalance, the 2 years old also, 60 years old also. But highly who will be greater risk? Okay, here you have to find out what is the complication of these conditions. Okay, so gastrotomy feeding, no problem. There will be feeding is going on, right? And sigmoid colostomy is there, then ileostomy is there, and renal adriography is there. So already post-op, it is 8 hours gone. Okay, so here you have to remember the ileostomy patient will be the high risk for the fluid and electrolyte imbalance. Okay, that will be the answer for you because the ileostomy patient, there is a high risk for the dehydration, electrolyte imbalance, and acute kidney injury. Okay, so if you know the disease condition, important point, you can easily answer it up. Okay, so here the answer is 40 years old patient who is in 3 days post-operative with the ileostomy. Ileostomy, there is a key point, greater risk for fluid and electrolyte imbalance, and they can give dehydration. Okay, that is also will be the change of the question. Okay, dehydration and acute kidney injury also happen for this patient because of dehydration. Got the point? Okay, let's see the next one. 40 years old male patient has a chest tube following cardiac surgery. The chest tube is patent and functioning. When the nurse removes the dressing, the tube falls out of the chest. Which is the most appropriate initial intervention that the nurse should take? Okay. So here the chest tube patient after cardiac surgery, the nurse is just removing dressing only, but unfortunately the chest tube came out. Okay, so what will be the intervention initially? First, what they have to do. So option, reinsert the chest tube and notify the surgeon. Second one, apply occlusive dressing to the incision site. Option C is place the open end of the tube in 3 to 4 centimeter of sterile water. Administer O2 at 10 liter per minute via non-rebreather mask. Okay, these are the options. Okay, you have to remember about chest tube. So if you just leave that chest tube, there is a hole is big, right? So this open injury is leave. There is immediately there will be the high chance of there is a pneumothorax. The air will go and there is a air will be filled into the lung cavity. It will cause the pneumothorax. Okay, so to avoid that, what is the first action? We have to be tell the surgeon, right? But we should not reinsert. That is the wrong option. Why? Because it will cause infection. Okay, no reinsertion. And the place the open end of the tube in 2 to 4 centimeter for steroid. If it is the other side is functioning, no problem, right? Other side of the tube, it is now the chest tube of the patient side is removed. If it is other side functioning, the bottle side is came out, you have to put it into the sterile water. That is correct. And here the administer O2, we have to be administer O2, but here first initial action, what will be done? The tube is removed. What you have to done? First thing, almost the best nursing care. First thing you have to do the apply occlusive dressing to the incision site. Okay, to prevent the pneumothorax. Got the point? So if they twist and ask you, sometime why we are applying occlusive dressing? To prevent the pneumothorax. Got the point? Okay, so it should be one more point. There's a question point of view. Another question they have just given you occlusive dressing, but how to apply? What will be the method? You have to remember opening chest wall, just put the gauze and will be in the occlusive dressing. Okay, three-sided only. That is very important. One edge should be free because why? It will to prevent the tension pneumothorax. It is only any air inside, it cannot come out. If you just put in the four-sided plaster, got the point? That to prevent the tension pneumothorax, we will put the three-sided plaster. Okay, so this about the chest wall question. If they ask you chest wall question, you should be able to answer. If it is from the patient side, you have to put immediately occlusive dressing in session. If it is in the bottle side open, you have to place the open end of the tube into the 2 to 4 centimeter. There is a sterile water you can dip. Okay, sterile water. That is very important. Okay, so these are the different type of question can come. Make sure you are just ensure the chest tube points. Okay, we'll move on to the next one. A nurse is preparing to transfer the patient from the operating table to the post-operative. The patient had the right total hip arthroplasty. The nurse must maintain the patient hip in which of the following position? So what is the, you have to know what is the after the surgery post-op hip arthroplasty position. Okay, so that is the question here. So post-operatively hip arthroplasty, what we will do is just to put the patient in the hip adduction pillow. Okay, here the, see, I've given you picture. This is the adduction. Sorry, abduction. Okay, adduction means it will be together. Like, no, it is abduction. That means the should be, it will be away from the body and centrally we will put the triangle pillow. Okay, why we have to do this? To help to prevent the hip from turning in and away from your body. Okay, to prevent this, we have to put the abduction. Got the point? So what is the answer here? Abduction. Always remember hip arthroplasty. You have to be put the patient abduction position. Okay, adduction, abduction, don't confuse. It will be away from the body, abduction. Got the point? Let's see the next question. A woman at 24 weeks gestational age has a fever, body ache, and has been coughing for the last 5 days. She is sent to the hospital with the diagnosis of H1N1 influenza. Which order has the highest priority? Okay, so here the orders are the assign a private room, vital sign every 4 hours, obtain specimen for sputum culture, ring a lactate IV. Okay, so all the options are need to be do. Okay, but they are asking higher priority. Okay, so you have to be remember here the H1N1, what is the disease? It is airborne. Okay, so you have to be very careful. Ensure that you have to be provide a single room, private room for the patient. That is the first priority action. After that, only you have to be just put the personal protective equipment and go and check the vitals and sputum culture and the IV line. Got the point? So what will be the answer here? H1N1 influenza. There should be the first priority assign a private room. Okay, so always remember, take the best answer. Don't just confuse. All the answer will be correct. Okay, let's see the next one. 40 years old woman, patient admitted with the Parkinson disease. Which type of diet is more suitable for her? Okay, they're asking for the Parkinson's disease. So as we know the Parkinson's disease, the patient have the difficulty in swallowing. Okay, so you have to adjust the texture of the diet. Okay, that is a very important. If you give just clear fluid like that liquid, there is a chance for aspiration also. Okay, it should not be very solid also. It should be semi-solid. Got the point? Write down the key points. It will be useful for your examination. Parkinson disease, it should be semi-solid. Okay, the food should be semi-solid. Got the point? So these are the very important medical questions from the Saudi Prometric examination. Here, the YARKUD International, we are giving all the nursing examination training. So here, online training available for the Prometric, Women, Peers and Nursing examination, SNB, MOH, THA, HAT, OET, and IELTS.